Infections remain a major problem for all patients with multiple myeloma, starting from those who are newly diagnosed and even worse for patients who have relapsed disease or refractory disease and have been exposed to many different types of therapy. For newly diagnosed patients, there are guidelines suggesting that for those especially at higher risk, antibiotic prophylaxis, careful evaluation for the risk of infections, vaccinations, self-protective measures like masks or hand hygiene are very important. For patients at very high risk, and especially those with hypogammaglobulinemia, it seems that the use of immunoglobulin supplementation can significantly reduce the risk of infections, and this is more pronounced in patients treated with bispecific antibodies targeting BCMA, in which the implementation of preventive use of supplemental immunoglobulin seems to reduce the infection rate by 50 to 80%. So these are the main measures. It is also very important for the patients, their caregivers, and the physicians to recognize the infections and be very aggressive when they manage patients with a suspicion of infection.